So first of all, thank you for joining us here today for the release of the Provincial Road Ambulance Program Review. I have with me Dr. Kathy Bradbury, and Dr. Bradbury is the Assistant Deputy Minister with the Department of Health and Community Services. I'm also really happy that in our audience today we have Christine Zillar from Fitch and Associates, and I need to acknowledge Christine's presence and all of the work that she's done, and as well we have Jane Heller from Jane Heller and Associates, both of whom were involved, of course, in doing this particular review for us. Our government places considerable emphasis on improving the delivery of all of our services and ensuring the most effective and efficient delivery possible. We recognize that we have to manage our programs and services in a manner that is fiscally responsible while meeting the needs of the people of the province. This commitment is reflected in the operational improvement processes announced last week by our regional health authorities. Our government is firmly focused on maximizing our considerable investments and enhancing the level of healthcare services received by the public. This includes how the province's road ambulance program is delivered. As you know, in December of 2012, the provincial government announced a comprehensive external review of the province's road ambulance program. And before I get into the details of that review, please let me take a moment just to outline to you the full scope of ambulance services that are in this province today. First of all, the provincial ambulance program is made up of the road ambulance program, which completes approximately 66,000 transports a year, a fixed-wing aircraft service that carries out approximately 1,200 medical transports a year, and of course our helicopters that complete approximately 80 transports a year. Our current road ambulance program utilizes 171 ambulances, employs approximately 800 staff, and has 61 different operators providing services, and is made up of 3 different types of operators, those being the hospitals, our RHAs, our private and our community operators. Over the past 10 years, the budget for the road ambulance program has increased substantially, growing from $14 million in 2001-02 to more than $50 million in 2011-2012. This increase can be attributed to a variety of factors, those including a greater number of ambulances on our roads and highways, more professional and trained staff available to respond to calls, rising costs of medical equipment, and operational costs such as fuel and vehicle maintenance. As with other parts of our healthcare system, we have seen an increase in demand for service. For example, in the last 3 years, ambulance transports have increased by more than 20%. With an average of 185 emergency and routine transports a day, extending over a wide geographic area, we have a system that is responsive to the needs of this province. However, while these extremely valuable services are being provided, there are always opportunities to make improvements to better use our resources and make the program more efficient. We have to ensure that the positive investments made to date are sustained and delivered in an efficient manner. Recognizing this importance, last November, a contract valued at $250,000 was awarded to the Fitch-Heller Partnership to carry out the review. The Fitch-Heller Partnership is made up of Fitch and Associates from Plate City, Missouri, and Jane Heller and Associates, a management consulting firm based here in St. John's. Fitch and Associates are considered by many emergency management officials to be the leading ambulance and emergency services consulting firm in North America, with more than 30 years' experience in this area. The provincial government asked for an honest and independent assessment of our current road ambulance program and recommendations to make it a high-performing system. This was not an exercise designed to cut budgets, but rather was designed to identify opportunities to take the resources we are currently using and advise as to how they can be best used to meet the needs of our population. What we learned is that there are inefficiencies within our current system and processes and opportunities for improvement. As part of the review's mandate, Christine and her team completed consultations with stakeholders across the province and collected valuable information and input using electronic surveys, roundtable discussions, and town hall meetings and interviews. This extensive consultations plan took more than 3 months to complete. The consultants undertook a thorough analysis, and their recommendations focus on how we can improve our ambulance services for the people of the province while ensuring optimal value from our investments. The final report was received by government on August 20th, and we are here today to share and release the report with the people of the province. Since receiving the report, my officials have taken the time to examine the findings and the 10 recommendations that were made by Fitch. It is our intention to work with the ambulance industry and stakeholders to review the report's findings and have further dialogue to identify the best possible path forward. Some of Fitch's key findings include that overall, our road ambulance program is not working as efficiently as it could be. For example, there are too many organizations involved in administration and operations. The program is not working as one single system. Rather, there are 61 unique systems based on licensure and geography. Approaches vary in how requests for ambulances are handled, as all 61 providers have their own call dispatch system. There is a need to improve our data collection so that we know where patients are picked up and how long transports take. There are a high number of non-emergent or routine ambulance transports compared to other jurisdictions. There are recruitment and retention challenges with our ambulance professionals, as well as the opportunity to maximize their scope of practice and fully utilize these committed individuals to their potential. The level of spending and rate of budget increase is not sustainable. So, based on these findings, the consultants have outlined a series of 10 recommendations for our consideration to be implemented over a 5-year period. The recommendations were responsive to the 7 deliverables, including in the contract, around governance, standards, models of delivery, staffing, technology and information technology, integration, and of course an implementation plan. Through this process, we have committed to bring about constructive change in the ambulance industry. We will carefully consider all the recommendations together with the identified implementation timeframe with our stakeholder groups. At a high level, these recommendations include creating a single agency to administer and oversee the ambulance program, enacting legislation, making changes to how we license our ambulance operators, implementing a central dispatch system, changing our funding model, introducing self-regulation for our ambulance professionals, changing the model of how we provide ambulance services in rural Newfoundland and Labrador, and implementing processes to address recruitment and retention issues of our ambulance professionals. While each of these recommendations is important, as a government, we fully appreciate the valuable role of our highly trained ambulance professionals. These employees are the backbone of a high-performing ambulance system. Now that the route is released, our next step will be to reach out to these individuals and other industry stakeholders and discuss with them the review and the recommendations and how we can collectively move forward to redesign a better and more efficient ambulance program to serve the people of the province. We also need to know what the public thinks about these recommendations. In particular, we want to engage such groups as our seniors and persons with disabilities, as well as industry stakeholders through a series of engagement sessions in early November. To help facilitate this important next step, we are working with the Office of Public Engagement and will be inviting the public to provide their views via the internet, email, and/or regular mail. We see this engagement process as the next critical step in the process. The feedback we receive will be used to inform the development of an implementation plan, which we hope to have completed late in this year or early in 2014. It is important to take the time to do this right. I look forward to having a dialogue in the coming weeks with the ambulance industry and stakeholders on how we can work together to provide a high-performing ambulance program for the people of the province.